Well, Allie Renison is a former trade policy advisor to the UK government and now works for the consultancy SEC Newgate. Allie, welcome back. Good to see you. What impact are these tariffs going to have in Ireland?
Well, obviously, there has been a huge increase, as Donald Trump himself has noted, over the last 10 to 20 years of American pharmaceutical firms who are setting up in Ireland and then obviously exporting a lot of sort of drugs back to the United States. Now, I don't think that we're going to see some kind of forced relocation or incentivized relocation of pharmaceutical manufacturing back to the U.S., as perhaps the president would like. But it certainly means that, the costs, how they absorb them, might in the longer term have an impact on things like sort of drug pricing, but I don't think we're going to see that in the short term.
Let's just park the politics for a moment and let me ask you about patients and what this might mean for the supply of drugs in the United States and elsewhere.
I think we need to distinguish between the short and the kind of longer term, and the longer term is just as important. However, in the short term, because medical sort of and pharmaceutical supply chains are so incredibly complex that actually it takes a while. There's usually a bit of a lag between, let's say, things like sort of tariffs taking effect and actually having a knock-on effect on sort of drug prices at the pharmacy, for example. But longer term, there is a question about as these manufacturers start to absorb the cost of potential tariffs, where do they pass them on and where do they actually end up? And the last thing I would say is that the big question is whether any kind of mooted tariffs, and we've had this sort of Section 232 national security investigation into sort of drug manufacturing because the US imports about 75% of its pharmaceuticals. The big question is whether any tariffs for the sector actually end up applying to the finished pharmaceutical products or on the actual, what we call the active pharmaceutical ingredients. That could make a big difference.
Well, here's another big question. Who should deal with the extra cost? Should it be patients or should it be the pharma companies? Should they just take the hit?
I mean, obviously, the drug companies are going to say that, ultimately, while they don't want to have to do anything that would impact on kind of patient access to medicines, that there are a couple of different factors that might mean that they have to push up pricing. Now, keep in mind that one of Donald Trump's main pledges, both in his first term and this term, is to actually cut drug prices. Because if you look at what, the U.S. charges for in terms of drug prices, it's much, much higher than many other parts of the world. And so I think what the drug companies are worried about is less actually just about the tariffs. They're more worried about actually what kind of direct policy and regulatory action that Donald Trump and the agencies that oversee kind of drug pricing could actually have on what they call sort of innovation. Their argument is that if there's actual direct policy action to try and force them to lower their prices, that then they will have to put that up and that innovation will be at a loss as a result.
So R&D might well take a hit in all of this.
That's one of the biggest arguments that pharmaceutical companies are making at the moment, that all of the money from their profits are effectively plowed back into research and development and investment. And that is certainly the narrative that is being put out right now, is that if there is more direct action outside of tariffs, but actually direct policy action around things like what's called sort of reference pricing, international terms for sort of pharmaceuticals, that they are going to have to cut their investment in innovation. And that may be where we see the immediate impact rather than actually it being passed on to patients.
Allie, good to see you. Allie Renison, former trade policy advisor to the UK government and now at SEC Newgate.